My name is Heli Chambi. I live here in Naples, and the reason why I'm standing here is that 11-year-old child right there, Santiago. Want to say hi?
Hi.
My son was diagnosed with autism. He's in the spectrum, also ADHD and cerebral palsy. Amanda's story actually hit home quite a bit, because everything that she went through with her brother, I'm actually experiencing with my son, because he's technically high ability, right there with normal, and it always falls through the cracks in every single system. Education system, healthcare system, there's always more requirements, and there's always more scrutiny for some reason. Even though already professionals, mental health professionals have already given diagnosis, there's always those hurdles that we have to jump, and those hoops that we constantly have to keep jumping. Last year, we went through a process called the unwinding process, where we had to we have to be reaccepted, for lack of better terms, into Medicaid, and my son was dropped. So he actually lost the ability to be linked to CMS or have Medicaid. Therefore, he lost several therapies. That backtracked the progress that he had on all these years, because he's been having therapies ever since he was 3. So I guess the ask today, it would be for protection, right? For these kids that have disabilities, right? That have developmental disabilities, and these disabilities don't get healed overnight, or with a pill, or with a regimen of medication, and then they're out of it. And these excessive boundaries and hurdles that we have to jump as parents, it is very frustrating. So safeguards, I guess for Medicaid, for all these children, it would be what I'm asking for, and also training for the staff, because we had to jump quite a bit of hoops last year in order to get reinstated into Medicaid. But that's very much what I would like to request today. Thank you so much.
Let me respond to that. I'm well aware of that problem. You're absolutely right. It was lack of training. They put all the children all together that were on the Medicaid waiver issue, and did not segregate the children with disabilities. We've been like white on rice yelling at them. I mean that.
Yeah.
Because it was a mistake. They shouldn't have done it, and I know my staff has been making calls, and we've been making calls to get people back on, and they've hired some new people, and
That's excellent.
it's the best part is people like Stephanie and yourself that alerted us to that problem. If you hadn't, we would have known, and so they're
One of the big issues also is the huge disconnect that we have between agencies.
Yeah.
ACA doesn't talk to APD or DCF, and there's a huge disconnect, right? And eventually the parents have to be 1, 2, 3 hours on the phone with these agents, and they tell you to talk to level 1 and level 2, level 3, spend 3 hours in there. Not everybody can do that. So it wasn't just the unwinding. Like with my son, for example, he has to be reevaluated every 3 months in order to get approval for additional therapies. It's not gonna magically after 3 months be healed, right? So yeah, I guess that's why they ask for additional training.
Thank you for that. That's